Okay, in our video series of ECG interpretation made easy, in this video we are going to talk about two atrial rhythms. We are going to talk about wandering atrial pacemaker and multifocal atrial tachycardia. Now remember, there are certain types of atrial rhythms that include premature atrial complexes. I have talked about premature atrial complex in detail in my previous video. The link of that video is given in the description below. Atrial tachycardia, wandering atrial pacemaker, multifocal atrial tachycardia, atrial flutter and atrial fibrillation. Now in this video, we are going to talk about wandering atrial pacemaker and multifocal atrial tachycardia. In the next video, we will be talking about atrial flutter and atrial fibrillation. Now remember, in a normal sinus rhythm of heart, that sinus rhythm of heart is run by a SA node. SA node produces electrical currents, and those electrical currents cause depolarization of atria. These electrical currents travel through the internodal pathways to the AV node, and AV node spreads out this electrical signal to the bundle branches and Purkinje fibers and causes contraction of the ventricles. This is a normal sinus pathway that is run by SA node. Now what happens in wandering atrial pacemakers, as its name implies, that there are almost three different foci where electrical impulses are generated that are causing depolarization of the atria. Three different pacemakers, three different ectopic foci are present within the atria, and they are producing electrical currents, and those electrical currents are actually causing depolarization of the atria. And what you will see on ECG will be three different morphologies of the P waves. There will be three different morphologies of the P waves. Every different focus will be producing a different morphology of P wave. Now this yellow ectopic focus can produce an P wave like this. The white one can produce an inverted P wave. This white one can produce a P wave like this. So there are different morphologies of the P waves because instead of SA node, these ectopic foci are producing electrical currents and they are taking over the electrical activity of heart. And since there are three different pacemakers, three different ectopic foci, so you will see almost three different morphologies of P waves. That is called as wandering atrial pacemaker. Now coming to the causes of wandering atrial pacemaker, how does these ectopic foci appear in the atria? The causes include vagal effect of respiration on SA and AV node. Sometimes it happens that a vagal stimulation slows down SA and AV node to an extent that these ectopic foci take charge of the atrial depolarization. Now, normally in a vagal respiration, you would not see these ectopic foci and these morphological changes in the P waves. But in patients who are already having a weak heart, patients of CHF, patients with atrial enlargement, patients with valvular conditions, such patients are already having damaged hearts, and in such damaged hearts there is a potential, there is a tendency to have these ectopic foci, and these ectopic foci get a chance to depolarize atria when the SA node and AV node is slowed down by the vagal stimulation during the respiration. Drug toxicity, digoxin drug. Digoxin is an amazing drug used in heart failure, but digoxin toxicity can cause certain types of arrhythmias, and they also can cause wandering atrial pacemakers to appear. Old patients, in athletes where there is hypertrophy of the heart, atrial enlargement, any condition that causes atrial enlargement like mitral stenosis, as in atrial fibrillation. In these conditions, atrial structure, atrial morphology is changed that results in formation of these ectopic foci. Now, if you look at this ECG, in this ECG, you can easily appreciate the morphology of this P wave is different from the morphology of this P wave, and this P wave is different from this one. So there are three different types of P waves that appear on this ECG. This basically shows that there are certain ectopic foci present in the atria, and those ectopic foci are generating electrical activity, and sometimes one ectopic focus generates electrical activity and it causes depolarization of the ventricles. Sometimes another focus depolarizes and causes depolarization of the ventricles. Now if you focus on it, you will see that the ventricles are contracting normally. The QRS complexes are normal. QRS complexes are having sharp points, they are narrow. There is no problem with the QRS complex because there is no problem with the ventricles. The problem is in the atria. The ectopic foci are present in the atria, so therefore you will see morphological changes in the P wave. You won't see any change in the QRS complexes because the problem is in the atria. The problem is not in the ventricles. Ventricles are depolarizing normally. Wherever they are receiving the signal from, they just depolarize. Now we will solve this rhythm strip. I have talked about how to calculate heart rate, regularity, P waves, PR interval and QRS complex in detail in my video on rhythm determination. The link of that video is given in the description. We'll solve this ECG now. Now if you calculate the heart rate, there are 1, 2, 3, more than 3 large boxes. So 300, 150, 100 and almost 80 to 90 beats per minute. So 80 beats per minute is the heart rate of this rhythm. If you look at the RR interval, the RR interval is equal, so it is a regular ECG. Now if you look at the P waves are present. Although P waves have different morphologies, the P waves are present and P waves are followed by the QRS complexes. There is not even a single P wave which is not followed by a QRS complex. It means that these P waves are actually causing depolarization of the ventricles. Wherever these electrical signals are coming from, they are causing depolarization of the ventricles. So P waves are married to the QRS complexes, but they have different morphologies. Now we will not write that the P waves are normal. P waves are not normal. P waves are having different morphologies and they are married to the QRS complexes. Now if we look at the PR interval, as I said that a normal PR interval from the start of P to the R wave, the PR interval should be less than one large box. So if you look over here, the PR interval is less than one large box. So it is a normal PR interval. If we calculate the number of small boxes, the small boxes are 1, 2, 3. So there are almost 3 small boxes and each small box is equal to 0.04 seconds. 3 multiplied by 0.04 is equal to 0.12 seconds. QRS complex. Let's look at the QRS complex. The QRS complex is narrow. A normal QRS is less than 3 small boxes wide. So it is narrow, it has sharp angles and it is less than 3 small boxes wide. Now what is the interpretation of this ECG? This is not a sinus rhythm. This is not a sinus rhythm because the P waves are not originating from the SA node. These P waves have different morphologies. These P waves are actually originating from the pacemakers, from the ectopic foci that are present in the atria. So we'll write it as wandering atrial pacemakers or wandering atrial pacers. Now in my previous video in premature atrial complexes, what was happening was that there were either 3 normal sinus beats and within those sinus beats sometimes you would see a premature atrial contraction from an ectopic foci. But in wandering atrial pacers, you will see that all the P waves are abnormal. Another very high yield point to remember is that a point that differentiates wandering atrial pacers from multifocal atrial tachycardia is that heart rate is normal in wandering atrial pacers. The heart rate is between 60 to 100 beats per minute and it is not tachycardic. If it is tachycardic, then this is called as a multifocal atrial tachycardia. We'll come to that in a while. Now what you should do is that you should pause the video and solve this ECG yourself. Take a piece of paper, take a pen and solve these ECGs yourself. Till the time you don't solve these ECGs, you won't remember anything. ECG is a very volatile subject. You will forget everything if you don't practice these ECGs. Pause the video and solve it yourself. Now coming to the answers. Now if you focus on the P waves, you will see that this P wave is different from this P wave. This P wave is inverted, and if you differentiate it from this one, this is a different P wave. So there are 3 different morphologies of the P waves, and if you calculate the heart rate is from 1, 2, 3, 4, 5 large boxes, more than 5 large boxes. So 300, 150, 100, 75, 60 and almost 55. So the heart rate is 55 beats per minute. If you calculate the RR interval is equal. It is a regular ECG. If you look at the P waves are followed by QRS complexes. So P waves are married to the QRS complexes, but the P waves are not normal. The P waves are having different morphologies. So we won't write that the P waves are normal and married. We will write it as married plus different morphologies of P waves. Now, if you look at the PR interval, a normal PR interval is less than one large box. So it is less than one large box. So it is a normal PR interval. Now, if you exactly calculate the PR interval, if you calculate the number of small boxes, the number of small boxes are 1, 2, 3. It's a bit blurry ECG, but 3 small boxes, every small box is equal to 0.04 seconds. So 0.04 multiplied by 3 is 0.12 seconds. If you look at the QRS complex, a normal QRS complex is less than 3 small boxes wide. So there are almost 2 small boxes and it's 0.08 seconds. So the QRS complex is narrow, it has sharp angles, steep points, so it's a normal QRS complex. So the interpretation of this ECG is not a sinus rhythm. This is not a sinus rhythm. These P waves are not normal. These are actually wandering atrial pacemakers. Now coming to multifocal atrial tachycardia. When you understand the wandering atrial pacemakers, multifocal atrial tachycardia is exactly the same thing. The only difference is that wandering atrial pacemakers have a normal heart rate, and if the heart rate is tachycardic, that is called as a multifocal atrial tachycardia. It is just the same as wandering atrial pacemaker, except that the multifocal atrial tachycardia is faster. A wandering atrial pacemaker with tachycardia is called as a multifocal atrial tachycardia. Very simple. If you understand the wandering atrial pacemaker, it becomes even more easier for you. Now, the causes of multifocal atrial tachycardia are all the ones that cause damage to the heart. Emphysema exacerbation, emphysema, all the pulmonary diseases cause cor pulmonale. They damage the right side of the heart because the lungs are damaged. The right heart tries to oxygenate the blood. The right heart pushes the blood to the lungs, but it cannot get oxygenated. So it tries to force the blood into it. There is pulmonary hypertension in pulmonary conditions, and all these pulmonary conditions damage the right ventricle, and right ventricle failure ultimately leads to problem in the atria and atrial pacemaker. Congestive heart failure causes dilation of the atria. Mitral valve causes regurg of the blood to the atria and change in morphology of the atria. And remember, multifocal atrial tachycardia can sometimes be confused with a coarse atrial fibrillation. Now wait for some time. In the next video, when we'll be talking about atrial fibrillation, we will have different types of atrial fibrillation, in which the coarse atrial fibrillation can sometimes be confused with multifocal atrial tachycardia. Now, if you look at this ECG is tachycardic. By the simple look of this ECG, you can easily tell that this ECG is running at a very fast pace. This is almost at 300 beats per minute, almost one large box between the two QRS complexes. So there is tachycardia. And if you look at the P waves, look at this P wave, look at this P wave, look at the morphology of this P wave. So these P waves are different from each other. Look at this P wave. This P wave is inverted. So if you look at this morphology of these P waves are different from each other. There are different foci that are generating these electrical current. That is called as multifocal atrial tachycardia. Now coming to the characteristics of multifocal atrial tachycardia, as I said that it is just the same as wandering atrial pacemakers, but heart rate is high. The heart rate is fast, greater than 100 beats per minute. Regularity will be mostly irregular. The P waves will be present, but they will have almost three different morphologies. They will be married to the QRS complexes. These P waves will be generating the contraction of ventricles and will result in QRS formation. PR interval will be either normal or it can be sometimes wide. The QRS complexes will be mostly normal. They can be wide sometimes. Now let's practice some ECGs. Now by the simple look of this ECG, you can tell that there is tachycardia. There is a very fast, rapid rate. Now let's calculate the heart rate. We have in the wider interval, we have more than two large boxes. So it's almost 300, 150, 140. So almost the lower end of heart rate is around 140, and somewhere it's very fast. It's almost equal to 300 to almost 1.5 boxes. So it's 220. So it is 140 to 220 beats minutes. It's better if you give a range in such ECGs. I have not written it over here, but you should write it as 140 to 220 beats per minute. In irregular ECG, calculate the shortest one and calculate the longest one and give it a range. The good method is that you perform the 6-second method of heart rate calculation. I have talked about 6-second method of heart rate calculation in detail in my video on rhythm determination. You can check out the link in the description below. This is an irregular ECG. If you look at the P waves, the P waves have different morphologies. The P waves are not normal. They are present, but they have different morphologies and they are married to the QRS complexes. Each P wave is followed by a QRS complexes. If you look at the PR interval, normal PR interval is less than one large box. So they are all less than one large box. So this is a normal PR interval. Now, if you look at the QRS interval are sharply pointed, steep angles, and they are narrow. They are almost two small boxes wide. Two small boxes is 0.08 seconds. So the interpretation of this ECG is that there are multiple foci of atrial rhythms and there is tachycardia. So there is multifocal atrial tachycardia. This is not a sinus rhythm. This is multifocal atrial tachycardia. Now what you should do is pause the video, solve this ECG yourself. Try it, make a wrong answer, calculate the things wrong, but at least give it an attempt. Now coming to the answer, if you look at this ECG, you will be able to appreciate the different morphologies of the P waves. Look at the different morphologies of the P waves. So it is there are different ectopic foci. If you calculate the heart rate of this ECG, you can also give it a range, or you can calculate it by the 6-second method. We'll calculate it as 300, 150, so almost 130 beats per minute. It's better if you give it a certain range where you also calculate this part. This is 300, 150, 100, and almost 80 to 130 beats per minute is the range of heart rate in this ECG. Now let's look at the rhythm. The rhythm RR interval are unequal. It is an irregular ECG. The P waves are present and they are followed by QRS complexes. They are present, they are followed by QRS complexes, but they are not normal. They are having different morphologies. They are married to the QRS complexes, but they have different morphologies. Now, if you look at the PR intervals, the PR interval, a normal PR interval is within one large box. So they are almost equal to one large box. If we calculate 1, 2, 3, 4, 5. One large box is equal to 5 small boxes, so they are on the upper border. So they are almost, if there were one small box bigger, so they would have called it a prolonged PR interval. So they are almost equal to 5 small boxes, and that is a 3 to 5 small boxes, the normal PR interval. So 5 into 0.04 is 0.20 seconds. Now, if you look at the QRS interval is 1, 2, slightly more than 2. So 0.08 to 0.10 seconds is the length of QRS complex. They are narrow, they are sharply angled, they are less than 3 small boxes. So the interpretation of this ECG is also multifocal atrial tachycardia. This is not a normal sinus rhythm. Pause the video, try to solve this ECG yourself. Now coming to the answer, if you look at this ECG, there are different morphologies of the P waves. There are different morphologies of P waves. And if we calculate the heart rate, we have 1, 2, and almost 3 large boxes. So 300, 150, 100 beats per minute. It's better if you calculate this narrow one as well and you give it a range. If we look at the RR interval, the RR interval are unequal. This is longer, this is shorter. That is a irregular ECG. If you look at the P waves are present and P waves are followed by QRS complexes, but the P waves are not normal. We won't write it as P waves normal as we did in the previous videos. In this video, we'll write it as present and they have different morphologies and they are married to the QRS complexes. If you look at the PR interval, a normal PR interval is less than one large box wide, and they are, so it is a normal PR interval. If you look at the QRS complex, the QRS complex is narrow, sharply angled, and steep points, so that is a normal QRS complex. A normal QRS complex is less than 3 small boxes wide. One small box is equal to 0.04 seconds. Interpretation of this ECG is multifocal atrial tachycardia. It's not a sinus rhythm. Now this is the last ECG. Pause the video, try to solve it yourself. Coming to the answers, if we calculate the heart rate in the wider interval, we have 1, 2, and almost 3 large boxes, so 102. If we calculate the narrow one, we have 1 and 2, so almost the heart rate is between 100 to 150 beats per minute. And the it is an irregular rhythm. The RR interval over here is wider, over here it's narrow, so it's an irregular rhythm. If you look at the P waves are present and they are having different morphologies, and they are followed by the QRS complexes. So P waves are present, they have different morphologies, they are not normal. If you look at the the PR interval is in the normal range. They are less than one large box wide. If you calculate the small boxes, we have 1, 2, 3, 4. So they are almost 0.12 seconds. 4 multiplied by 0.04 seconds. Small box is equal to 0.04 seconds. If you look at the QRS complexes are very beautiful, small, narrow. The QRS complexes are normal in a multifocal atrial tachycardia and wandering atrial pacemaker, because the problem is in the atria, the problem is not in the ventricles. The interpretation of this ECG is multifocal atrial tachycardia. Now coming to the management of multifocal atrial tachycardia. In the management of multifocal atrial tachycardia, you always have to look for the underlying cause. Sometimes electrolyte abnormalities like hypokalemia, hypomagnesemia, these electrolyte abnormalities can cause many arrhythmias. In every arrhythmia is almost always correct. Always look for electrolytes. In any arrhythmia, always correct the electrolytes. We have the medical therapy. In medical therapy, beta blockers are given to control the rate. As I said, multifocal atrial tachycardia is having tachycardia in it. There is increased heart rate, and beta blockers are given like metoprolol in patients that are not asthmatics. In asthmatics, you cannot give beta blocker. In asthmatics, you give calcium channel blockers like verapamil. Beta blockers, metoprolol, are given 2.5 to 5 mg IV bolus over 2 to 5 minutes. If there is no response, you repeat the dose. And in asthmatics, you use calcium channel blocker. Do not use beta blocker if the patient is asthmatic. So the underlying cause must be treated in multifocal atrial tachycardia. Before going into the summary, if you liked my video, please click on the subscribe button and make sure to watch out the next videos. The next videos are on atrial flutter, atrial fibrillation, and after that I'll talk about atrial ventricular tachycardia and ventricular fibrillation. Those are very high yield topics that you must know. We'll talk about the brief management as well. Now we talked about what are wandering atrial pacemakers, 3 different pacemaker locations, the causes of wandering atrial pacemakers, the heart rate is normal. Then we talked about multifocal atrial tachycardia, which is just as the same as wandering atrial pacemaker, but it is faster, the causes, and then we solved the ECGs and a brief talk about the management. If you liked my video, please click on the subscribe button and check out my other videos on ECG interpretation made easy. Thank you very much.